All right, so Dr. Vicky Pinkney-Atkinson is the director for the South African NCD Alliance, and she joins us now live via Skype to take the discussion further. Good afternoon to you, Doc. Thank you so much for coming through here on the SABC News channel.
Thank you so much.
Now, there is a clear pattern between comorbidities and COVID-19 deaths. Do you feel that enough has been done to sort of highlight this particular issue?
Well, I'm very glad that at least we're making some progress on it being recognized. You know, I think up until now we've been really not in the dark, but we haven't been talking about it in the way that it's now being spoken about. It's not just about age. Age has always been a very blunt instrument. It's really about the non-communicable diseases that people have at the time in which they get infected with COVID-19. And then on top of that, it's whether that chronic illness, that long-term illness is actually well controlled. So I would expect that a lot of the deaths are in people who are poorly controlled, they get COVID and they die. So for me, none of these figures are in the least surprising. What is very sad is it's taken so long for this to be put out like this, instead of just making it about old age. Thank you.
But from the clip that we've just listened to, I believe you'd agree that this may be a good move, that Cape Town is now prioritizing testing those who are over the age of 55?
Absolutely. It's a very good step forward. But what I'm really trying to say, and I wonder if we could just put the first slide up that I presented, the picture that I presented of what I'm trying to get over, is that it's not necessarily about age. It's about whether, this is a picture that shows that if you have a good, well-controlled diabetes, for example, which is one of the biggest risk factors, your survival, that means your blood sugar at the time you get ill is well controlled, less than a certain level called 10. Your chances of survival are like you almost didn't have the diabetes. But if you get to the other side and you have poor control, which we know is what's happening for most people, is that it's a really underdiagnosed condition. And that's why, so that's really the point. So what this slide is saying to me, if you know you've got diabetes and you take care of it well, you can be fine. And the evidence is pretty clear on that, irrespective of age by and large. But if you have, even if you're 45 or 35 and you haven't had it diagnosed and it's not managed properly, then you're probably in trouble if you get COVID. So that's really the message of this slide. I'm not sure if I'm getting that across clearly.
No, very clear. So what about, you've made mention of diabetes and having it under control, but what about other chronic illnesses? Is it the same scenario that if it's taken care of, things will still be okay?
And that's exactly what I'm saying. The evidence, for example, young people who are on insulin, who are well controlled, the deaths from it. And really we're talking about deaths because that's really the worst endpoint I guess you can have. And so they are surviving very well. Most studies are showing if you have good control and don't have a whole lot of illnesses, you're well controlled. Yes, exactly that. And the same for asthma, high blood pressure. The trouble is in most of the cases that I'm reading and all the studies from overseas, and what we're trying to tell people is that, number one, stay on your medicine if you've got a diagnosis. But we've had neglect in South Africa across the country, and the problem is that NCDs are not managed or treated properly. And that's really where we are. But what Cape Town's doing is great about stratifying it. But all I'm saying, it's not just 55, and lots of people won't have the diagnosis. Do you know that in Cape Town, for example, for years and years, the leading cause of death amongst women has been diabetes. So it means the problem in Cape Town has been there for a long time. The rest of the country's caught up. So if we can go to the next slide, if I could show you just a picture. This is what I'm trying to say, that it's not just age. So here's a district map that a colleague of mine, Peter Hers, and I were working on, because we were trying to show that, for example, it's not just about age. But here we've got a map of South Africa that we've done from Stats SA, and we've mapped the districts, and the darker the color, it means the greater percentage of people who are over the age of 60. And those are, we think, higher at risk. Now, you can see where all of these pictures are. They're in the metros. The dark colors are often in the Eastern Cape and other areas where the testing is not necessarily happening. And we also know that, for example, we need more supervision when people are sitting waiting to go for their pensions. You know, in the Eastern Cape, one of the worst regions is the Chris Hani region. And if you look here, it's got the highest number of people who are over the age of 60. Those people have to get in buses to get their pensions and get their food. And then we've seen the terrible queues. This is a district disease. It has to be managed on a district and sub-district region. And if you just look at the next one, by slide by age, I'm doing the top 20. I don't know if it's there that I put in it, but these are figures from Stats. But it showed very clearly that 6 out of the 8 districts in the Eastern Cape were all high risk for having a population that were over 60. It's not the only thing, but it's a blunt instrument. If you're over 60, the chances are you've got more of these comorbidities. They may not have been well managed. And so what that's doing from the top districts, which are in the Eastern Cape, the darker green are the Western Cape. And so we're looking at these to say that these are high-risk areas because of the number of older people. So I think there are other implications. What's happening in the Western Cape is wonderful. But what is also happening, if I can also say, is that people are too scared to go to the clinics to get their medicines. So that means that then they won't be taking their medicines properly, and then they're going to be uncontrolled. And then if they get COVID-19, then they will be at greater risk. So it's sort of it's a cycle. So what I would really like to see is it managed at a district level, that each district and sub-district is taking a look at their stats, and also finding ways to manage and screen people and get them treated as early as possible, and make a way for people to get their medicines without putting themselves at risk. And it's been done very successfully for HIV. The CCMDD reaches most of them, 4 or 5 million people who are on HIV medication. There are many more than 5 million people who have NCDs, but the same facilities have never been extended to them. And for that, I think is the shame. We also need, so that's one, is find people and screen them and treat them, but not so that it puts them at risk. And then the other thing is make sure they stay on treatment and the treatment's available. And then the final thing is, how do we have a way of, we haven't really addressed to people what they need to do about staying safe.
Yes.
Because if you're one of these people, what do you do if you've got, like me, I've got lots of comorbidities. There has to be a plan in place of how do you stay out of harm's way until there's a vaccine. Or what do you do if you haven't got one? So we need a bigger discussion around the concept of shielding. How do you stay out of harm's way for an extended period of time if you live in a multi-generational household?
I think you're raising quite an important question there. Maybe you can just answer it for us. So how do you stay safe if you do have those comorbidities? What do you need to do to guard against contracting COVID-19?
Okay, so the point is that you're not at greater risk for getting COVID if you've got the comorbidities, except in some unusual. But the problem is if you get COVID and you are uncontrolled with your NCDs, or you have a lot of complicated one, then you are at risk, much greater risk at dying. That's been, if anybody's looked at the stats like I have been looking at since December, January, it's very clear that pattern, and we need to do that. So how do you say, I have made the personal decision to stay at home, and as you can see, I've got a lovely home and I can do it. But it's and I can also work from home. But how do you do it in your kind of area, and if you live with lots of other people and so forth and so on? So I've made the decision that I'm not prepared to get the COVID if I can possibly manage it. So I'm shielding, staying at home, doing what I can to stay at home and stay out of harm's way, going out very infrequently, getting my medicines sent to me. I need to have public service medicines, but I can't afford the risk of going to a clinic, so I am paying for my own medicines and those of my housekeeper. So both of us, so we don't have to go out unnecessarily. When you have a person who lives in a smaller environment and with kids going out to school, then it's a different situation that people have got to talk about. And I think that requires, again, a much broader discussion. And young people, and that's one of the problems, for example, if you look at the Eastern Cape. The Eastern Cape has got a high dependency ratio. There are lots of older people, as we saw from those figures that I was putting up. Those are Stats SA's figures. So it means that there are lots of older people possibly looking with younger people, and if the younger people are coming into contact with the illness and they go home to granny, then the chances are that maybe there's going to be cross-infection. So how do we manage those kind of issues?
Yeah.
And that's the discussion I think that we really need to be having. And are those old gentlemen and older people, are they well managed, or are they not treated properly or not screened? So it's I think it's a community discussion, I think it's a district discussion, and it's one that we have not had in this country to any great extent.
And I think once again it brings to light the inequalities that exist in South Africa. I'm afraid, Doc, we have to leave it at that, but thank you so much for coming through. Dr. Victoria Pinkney-Atkinson, she is the director for South African Non-Communicable Disease Alliance, talking to us via Skype.